Now, you heard in Lisa's introduction about the importance of pathology, and the reality is that although we all talk about cancer as if it's one disease, cancer is hundreds of different diseases. In fact, I mentioned the work that's been done in lymphoma earlier. Even within one cancer that we call lymphoma, we recognise 32 different types of lymphoma. And the reason it's important to break it down like that is all of those forms can have different treatments, different prognosis, different options, all sorts of different things that can be done. So just simply knowing, oh, it's cancer, doesn't tell us anything. It doesn't mean that we know the best way to help that patient. Lisa was saying before that there are dogs that have done badly because they didn't have pathology done, and that's very, very true. I'd like to add to that and say the reverse is true, or at least the opposite scenario, which is people assume too much. And there are, unfortunately, countless dogs that have been put down because it looked like it was cancer. Okay? And so in the same way as you can't tell something's cancerous by looking at it, you can't tell it's not cancerous by looking at it. The bottom line is to support what Lisa said before, which in the vet trade, what we say is basically if it's worth removing, it's worth sending off. Okay? And the comparison is you wouldn't have a discussion with your vet. You wouldn't have a discussion with your vet about whether you want that vet to stitch up the wound after taking the lump out, you know, or whether you want them to use painkillers after surgery. All of that stuff is just assumed. The pathology should be assumed as well. Very quickly, I don't want to get too technical, but I will briefly just talk about options with biopsies, because in broad terms, if any of you ever have a diagnosis for cancer made in your dog, you're going to need to work out how do you diagnose it, and there's lots of ways of doing that. Very, very quickly, the three that you should be aware of there is, the first is just putting a little needle in, a hypodermic needle, fine needle aspirate. And the neat thing about that is it's quick. So if there's ever a concern, you can get that done and you'll have results within 24 hours. The cost is not horrible too for that procedure compared to the others. So that's a nice thing to do, but don't overestimate what that's going to tell you, okay? That test is really just good for a couple of different cancers and answering specific questions. So in other words, if there's a skin lump there, it might be enough to say it's a fatty lump, but it won't tell you if it isn't a fatty lump what it is. But at least it means you know you need to do something about it if it's possibly more serious. So don't put too much emphasis on the value of that test in terms of giving you an answer. If you want the vet to be able to say there's a lump and this is what it is, you must remove a piece of tissue. Okay? And that can either be a surgical thing where they take a chunk, or you can get them to use a biopsy instrument, which is like a little tiny apple corer, basically, and takes out core samples from it. But the bottom line is a biopsy is not necessarily a biopsy. And so just have in your head that if you need to know exactly what's going on, you are going to need a piece of tissue of some form, at least with current technology. So what do we do once we've got that biopsy result? What is it that the lab is going to tell me that says I know the best way to look after your dog? And essentially what it comes down to is research. That what I'm going to be advising you or someone else is going to be advising you really just is based on saying, well, when 100 other dogs were in this exact situation, this is what was done, and that was better than what had been done previously and previously before that. And so over the years, we get more and more evidence of what is the most effective technique for that particular disease that the biopsy is going to show. That research is ongoing, obviously. We haven't learned everything about cancer yet. That's still a little way off. So we need more research as a way of answering those questions. Now, Lisa's very excited, as am I, about a national block of research at the moment that's going on into bone cancer in dogs. And if your dog gets bone cancer, apart from the rare chance of only 2%, to be frank, that dog is going to die of that disease. So it's a horrible disease. What we've identified in lab research, so not treating dogs but just simply looking at the cancer, is we've identified an enzyme thiodoxin reductase, which is critical in the spread of that cancer. That cancer can't spread elsewhere in the body without using that enzyme. And what's neat is we've also found a drug that blocks that process. Now, we don't know yet how effective that is. Maybe it's something we need to do before your dog gets cancer if it's going to work, which means obviously it'll fail. But on the other hand, what if? What if blocking that enzyme stops that cancer spreading? Okay? Those dogs can have their tumour removed, they go on the medication to block the enzyme, and all is well. The drug that's been found is actually an old drug. It's not something that has been invented for this purpose. It's something that basically we already had available for arthritis, and it turns out to be suitable for this. The only way we find out is to have a large number of dogs with bone cancer treated with that drug, and then compare that to what we found they would get otherwise if we weren't using it. And without it, the averages are roughly around about 12 months, depending on the type of subtype of bone cancer. But the point is, we can then put the new patients on that medication and work the answer out. The difficulty for those people coming to see me with a dog with bone cancer at the moment is I can't tell them whether it's going to work. And so it's a big ask when someone recommends a research trial for your dog. It's always what you want other people to do so that the information is there when you need it. But all I can do is encourage you when those sorts of options are available, not only is there potential to help your particular pet, but it also, the answer, whether it's yes or no, the answer is still going to help the advice given to people down the track, and therefore it's a critical thing. Another bit of research that's just about to start. If we look to the holy grail of cancer treatment, just imagine if you just simply had a single injection into the tumour and it just went away. The reality is we've achieved that, but only in mice. And mice are not, you will have all heard a lot about mouse research going on in labs. The problem is that mice are not normal. These are not even normal mice that are used in labs. They're heavily bred specifically for the research it's been doing. But nonetheless, we have managed to get to a point where we can harness the immune system to block that corruption that I mentioned earlier and actually fight the cancer back and destroy it. And we're doing that remarkably successfully in that group of mice. So what we're about to start doing now, what we're going to start doing now is running a research trial where dogs come in with cancer, they get that injection. If we can harness the immune system in them, those tumours should melt away. No treatment afterwards, no ongoing chemo, no radiation, potentially no surgery. Now, obviously to have something that would be that unbelievably amazing, the chances aren't good. It's quite possible we'll find for some reason it doesn't work as well. But even if it half works, all of this is going to be absolutely amazing. And this is what is happening on the cusp of where we're at. Okay? So the point I'm trying to make about research, I guess, is it has to happen if we're going to move forward. And the end result of that research, whether it's your pet involved in that or not, is down the track, the next group of people that come in to see me and other oncologists are all getting up-to-date advice on exactly what is the best thing, whether it's that injection or the new treatment for bone cancer or what have you. When you put all that research together, there's huge amounts of it happening all over the globe. So I've told you about 2 studies that we're doing at the moment. There's other places around Australia, then there's other places all through Europe and all over the US that are all involved in various research programs as well. And the problem that presents is then when you look at the big picture, there's a huge amount of data. So that if we look at the amount of volume coming through, you're looking at several research results coming through every single day, okay, just for dogs with cancer. When you then translate that over a year, what it means is that the volume of stuff is so large that even just to stay up with the topic of cancer in dogs is a huge time commitment. Where I'm heading with this is when you then expect someone to not only be up to date on cancer, but up to date on every other disease that dogs get, it becomes impossible. And so this is where the role of general practitioners fit in. Lisa's got some concerns about how well various dogs have been managed with the diagnosis, and while I'm not trying to condone anything other than best quality medicine, I do need you to understand that the volume of stuff now is so large that you can't expect anyone to know everything. So a general practitioner, a good general practitioner, should be there to give you the right advice on how to move forward, but not necessarily the whole picture. You can't expect them to know about the research results that I'm reading because the volume of stuff is too great for them. So then you end up entertaining the idea of seeing a specialist. There's specialists in lots of different fields. By definition, because I'm a specialist in medical oncology, it means I'm not a specialist in any other field because the volume is too great. So if you take up the offer to go and see a specialist, then at least the positive side of that is you're going to be seeing someone who knows the nitty-gritty on their particular topic, and that means your dog is going to get the best possible care that is known. When we look at all that together, everything that I've mentioned today, the bottom line is then, or rather the big picture for that, is that we end up in a situation where with the right approach, the right initial biopsy, the research to back up the actual evidence for what we know we can do to help those dogs, we're going to end up in a situation where your dog gets the best possible care. And that's what it's about. As I said, it's not about fighting the cancer, it's about helping your dog.